let me introduce our panel to you. We're going to look at, of course, we've already looked at the idea of remote in terms of the patient, remote monitoring and remote consultation, but now we're going to look at this institute's experiences of opportunities and challenges of doing healthcare improvement research online. You see, they've jinxed it. We have two new imperatives now: the need for evidence for addressing the challenges of COVID by the NHS for its systems and processes, and the need to retain the participatory ethos that is central to improvement science. But of course, all of this now has to be done remotely. This session is going to cover how this has been achieved through the lens of this institute, sharing some of the learning about the potential benefits of doing research remotely, and also covering some of the issues raised by trying to ensure inclusivity in the new remote research landscape. So can I welcome Sanhita Chakrabarti, Lisa Hinton, Sandra Igwe, Ruth Kern, and Jan van der Scheer. And can I ask each of you to introduce yourselves, starting with Sanhita.
Thank you, Vivian. I'm Sanhita. I'm a public health consultant, and I work in Bedfordshire, Luton.
Thank you. Lisa.
Thank you, Vivian. Afternoon, everybody. I'm a social scientist and a senior researcher at this institute, where I lead research on improving maternity care. Much of my research historically has been based on doing in-depth interviews with patients about their experiences of health and illness. And that normally involves sitting on a sofa with them and doing interviews face-to-face. So for me, the shift to doing remote research completely this year has been a very, very interesting journey. I've been leading research in the last 8 months looking at the transition to remote antenatal care. And we have conducted that research entirely online through a survey and online and telephone interviews, which I can look forward to telling you more about during this discussion.
Sandra.
Hi everyone, my name is Sandra Igwe. I'm an inclusion consultant and I am the founder of the Motherhood Group. The Motherhood Group is a support platform that also raises awareness to the issues surrounding the Black motherhood community. I established the group 4 years ago after encountering stereotyping and also unconscious bias from maternity services, and found that mother and baby units did not really create safe spaces for Black mothers like myself.
Thank you. Ruth.
Thanks. I'm Ruth Kern and I'm the Strategic Development and Enterprise Lead at this institute. And it's my responsibility to look after Discovery, which is our remote research platform at the institute.
So you hope it all works well all the time. Jan.
Thank you very much for the introduction. I'm Jan van der Scheer. I'm a research associate at this institute. I've been working on different projects that involved online consensus building, online consultations, including a project focusing on the management of obstetric emergencies in women suspected or confirmed with COVID-19.
Great stuff. Okay, so let's talk first to Jan and Lisa. What have been the key benefits and challenges about online research? And is there anything that you feel isn't suited to online research? Lisa, let's start with you.
So I think the first, just to come to the advantages and the opportunities that it gives us. I mean, the first thing to say is that we wouldn't have been able to do any research to understand what's been going on with this big shift that we've been talking about on many clinical areas throughout the day, had we not been able to do online research. And it allows also it's much more convenient. It allows for participation in small windows of people's day rather than requiring big time commitment. The thing that I'm really excited about is it allows a lot more diversity in terms of the people that you're able to include in your research, both in terms of geographical spread. The remote antenatal care project that we've been running has had participation from all the way to the top of Scotland through to Wales and all over England as well. But it also allows for a more inclusive approach with participants. So those are the advantages. I think there is a significant disadvantage in terms of the rapport and the relationships that you're able to develop with online methods, whether they're online interviews like something in a platform like like this, or whether they're over the telephone. I think we all appreciate that there is something that is lost in these communications. The counter argument to that is, I think we're much more comfortable with this in November 2020 than we were in November 2019. We've all of us have transitioned to feeling very much more comfortable talking into a computer. So I think, and the other big disadvantage, which has been raised in previous sessions with regards to the shift to remote care, is the extent to which, for all of the opportunities it provides, it excludes other people. So there's a serious risk around digital exclusion that I think we need to be mindful of.
So Jan, digital exclusion is obviously a disadvantage. What about that other question about types of research that are not suited to online?
I think where we would struggle is things that would, for example, take place in a lab. In the past, I've also worked on physiology-related research. I'm sure there are ways, for example, to still do certain things, but a number of those things are just I don't think you will be able to do that through online platforms.
And how has it made you think about your practice after COVID? You know, what will you retain, and is there any going back? And I also wanted to ask you all about the cost of this, because you know, the costs are less. There are far fewer travelling expenses, for example. So I can see that funders are going to be very keen to keep the online model as much as possible because of the big reduction in cost. So what will you be doing afterwards, Jan?
I think I would also continue to keep going on all the lessons that we've learned. It's not just also it's parts of the research that we are doing. I think some of the benefits that Lisa was describing, I definitely have experienced those myself as well in the research that we've been doing, but also to be able to work with larger expert groups, for example, and then those expert groups would involve different types of stakeholders, to be able to bring those groups together more easily. If you think about the logistic challenges of people with different types of diaries, to bring them all together, that's so hard, and through these online platforms we're able to do that much more. But what I also hope and I also think is that it's perhaps slightly easier for people with different backgrounds to provide their input, and hopefully these online platforms can be a way of sharing and giving a voice to people and working around the power balances that we always have to consider when doing research among, for example, patients, clinicians, and other stakeholders.
Now, an interesting question from Alison Powell, liked by a lot of people, is can online research methods ever replace in-person observation of a setting? Is there a risk that research funders, as I just suggested, will become less willing to fund expensive, labour-intensive ethnography? And can I just put on my other hat, which is as a board member of UKRI, I will actually raise that question with the HRC because I do think it's a really important question. But do you want a quick comment on that, Lisa?
Love to. I think in the same way that we need to really rigorously understand what has worked and what hasn't worked in remote consultations, we need to reflect on what works and what doesn't work in terms of online research. So there are lots and lots of methods and approaches where online works really well. We've talked about them, geography. You're absolutely right. We can do more research in the time available. We can interview more people because we don't have to travel around. But equally, you can't do observational ethnography online. You cannot be on a hospital ward online. So we need to think about what our research methods are trying to understand and what is worth keeping hold of. And there are significant advantages, but what we absolutely need to do face-to-face. And I think in terms of funders, we need to try and sort of start opening up the evidence, gathering the evidence, describing it, and then making the case for a more balanced and blended approach going forward.
Let me turn now to Sandra and Sanhita, because you are the kind of consumers of a lot of this research, or you're involved in it too. How do you feel about remote research? Sandra, let's start with you.
My experience in participating in remote research was very, very positive as a whole. I'd say just sharing, one flyer across our platforms on social media, using our, newsletter platforms and our support groups. We received many mothers who actually wanted to express their views and, take part in research. And usually they'll be kind of reluctant to do that due to many factors. They believe that through this research, they will be able to be heard, have their experiences validated, and potentially contribute to possible positive outcomes for mothers, including Black mothers. So that's a really, really good point. Being able to share and receive and communicate ideas, thoughts really quickly and effortlessly is a positive impact, I think, for remote research. We're used to hosting events, physical events, hosting support groups physically. So we've all had to kind of change the way that we, support and engage with our mothers from the community. But I think, remote interviews, remote surveys is an amazing way to engage with the Black maternal community, as it provides a safer space for, mothers to share their experiences, as many mothers may feel less willing to share thoughts face to face, or due to fear and things like shame and other cultural factors that impact the way that we as a community take part in research.
So an enthusiast there. Sanhita, what are your thoughts?
So absolutely, we need to recognize the benefits that we are seeing in the new way of working, where we are doing remote consultations, remote research, which is very important because it will hopefully expedite and take out and give us some of those evidence that we need sort of now, because we've changed our clinical processes very, very rapidly in the last few months. Things that in a pre-pandemic world would have taken us years to change, we've rapidly brought on some of those digitalizations in patient care, and the remote consultation for antenatal care work that we as a system we are participating with Lisa. We absolutely need that in our system, because we've changed our systems and we need the evidence now and the framework to ascertain whether that is, the safe way, what elements are good and what elements to continue. For that to happen, without the remote research platforms, we can't expedite and get that data, that intelligence and knowledge. But the pitfalls are, of course, about inclusivity of sort of including everyone. The clinicians also feel very supportive, because it's timely. They can log on to sort of sessions online, like we're doing today, and get the advantage of being part of something. Whereas, in a previous world, it would have been very, very difficult to take time out of clinical world. So I would say there is definitely a lot of learning, but I think there is more to learn about whether this research will give us all of the evidence we need. But it's absolutely timely and it's needed for now.
Yeah, so that's an interesting point you make, that you don't know how much evidence you're really getting, and because what's the gaps, what's missing using these approaches. Ruth, rather unkindly, I want to turn to you in view of our technical problems and say, what are the practical and tech challenges to do with delivering research remotely?
Well, I think probably the key one that we found is that it isn't a case of translating a research task that you might carry out face-to-face directly onto an online platform. It's not a one-for-one substitute. And so we've had to do a lot of thinking around how we develop online experiences that are comfortable and easy to engage with and engaging for people. So I think it hasn't been, as I say, a straightforward translation. I think working in this particular sphere, there are a range of technical issues around communicating with NHS members of staff. So it would be very helpful for us if the NHS had a single security profile, for example, that we could work with. But of course, that isn't how it is, and it's a very diverse field out there. So it means that we're adapting to local circumstances circumstances sometimes. But I think also the other thing is sort of thinking through how people might want to possibly interact with the research tasks in advance, because you can't improvise and ad lib online in quite the same way that you can if you're doing a face-to-face interaction. So we've found ourselves thinking through all of these user journeys about how people might want to interact with the online platform in lots of different ways. So those have been some of the kind of practical challenges.
Somebody's asked here, and I think it's a really, really good question, whether there are any particular ethical issues associated with online research. Who'd like to answer that? Perhaps one for you, Lisa.
I guess it depends what's behind, what ethics that individual, behind that question. I think one way of looking at it is, no, there are no different ethical issues that don't exist in doing research face to face. I think there's a strong argument that anything one does online that is safe, the same issues apply. I think there is an ethical, we've touched on it already in this session, there's an ethical issue around who we can reach and how inclusive our online research is. And obviously we can't see what we're missing. And I think ethically we need to, if we want to do rigorous, inclusive research that captures diverse views, I think online research offers lots and lots of opportunities, but we also have to accept and explore what it's closing off to us.
Sandra, I've got a couple of questions for you. The first one is, a couple of people have asked, and this is Dora Angali, how can online rapport building be improved? So from your experience and the people that you're involved with, or the mothers you're involved with, how do you think that, that online rapport could be improved? What do people come back to you and say after they've had sessions with researchers? And what do you think they could do that would make things better?
Thank you. I think it's really important to show, that you genuinely care. So not just about the topic, but also about the participants, about the people, and about the community that you want to gather information about. So genuine care, and that can be shown in a number of ways, the work that you do afterwards and the work that you do before, and the genuine involvement in, organizations like myself, the Motherhood Group, where you're actually taking part in wanting to improve as a whole the health outcomes of, all people, all women of all races and ethnicities. So that's a really important part to mention. COVID-19, for example, has genuinely affected, the BAME community as a whole. And, we're more at risk of becoming unwell due to COVID. So many women in our network have, expressed that they feel vulnerable, they feel distressed or worried. And so when they're taking part in this remote research, they want to feel like they're safe, they're in a safe space. And so I think just reassuring them that the work that they're doing will, improve outcomes as a whole, making sure that their environment is safe. And it's all online. So if they're at home, making sure that when they're relaying information at home, they feel safe at home as well, because many mothers won't feel safe in their home. And that's a really important factor to consider as a whole. But I would just say definitely the care and the genuine engagement with the community.
That's really useful. And I've got another very quick question for you, which is, and several people have asked this, is, we're all bombarded with social media, bombarded all the time. How do you make research offers distinctive so that they're not lost in the kind of torrent of stuff that's piling into your inboxes?
Sorry, could you repeat that last part? Sorry.
Well, how do you make sure that research offers coming through social media are not lost amidst all the other stuff that's coming through on social media?
Yeah, there's a way. It's making sure that the communication is ongoing and not just a random link. Can you guys want to take part? Making sure that you're having that constant communication, that constant engagement with the community that you're trying to, be engaged with. And that's what we do on a day-to-day basis. We speak to them, we ask them how they are outside of research, so that they have, they've built that trust and that understanding between those who they're speaking to, so that when we do say do you want to take part in this research or fill out this questionnaire? It's not just a random spontaneous link. They've had that, that previous conversation beforehand, and that way they feel like they are being listened to, they feel safe, and they feel definitely that they have a genuine understanding between the person that they're trying to, connect with.
Thank you. Ruth, I want to talk to you about money to you, because when we think about PPI, there is funding available for PPI. It's an accepted cost. I always think that when you start to talk about digital, people think that digital costs nothing and that there shouldn't be somehow any expenses. But, are there things that we still need to think about in terms of costs and helping people, patients or other consumers who are being approached using digital?
So I think that there are, as Lisa identified at the beginning, I think there are cost savings to be made around travel, for example, and time. It's much more efficient to be able to do things online. But as a platform itself, Discovery obviously has a number of people that work on it. At the moment, each response to each project is very bespoke, so it's not at the stage yet where we have a kind of a standard interface that we can use. And I don't anticipate that we would ever quite get to that point, because each research project is very unique and very different and has its own specific requirements. And so I think we will see, as with most technologies, we will see costs coming down over the years, but that does, as you say, that doesn't mean that they'll ever get to zero. And I think there are other costs associated with, for example, recruitment, which are real world costs, as it were, that won't necessarily decline either. So it's not a complete solution to cost, but it should definitely have efficiencies, I think.
Thank you. I wanted to ask you all as our final question is whether we're going to see an increase in the use of remote methods going forward, and will more blended research approaches that offer remote and in-person pathways become more common, and how would that work for all of you? Let's start with you, Jan.
I believe so. I think we will definitely continue to see a lot of these type of online consultations, online consensus building exercises, online ways of engaging with various groups of people. I think I've also been impressed with the speed and the scale at which we're able to work, or I've seen the potential of that. I think that's really, really interesting, both from an efficiency point of view, as well as hopefully to a large extent also the inclusion of all these different types of people, recruiting on the different voices that we have across the NHS, from patients, from carers. And yes, I mean, post-pandemic, this is of course when we're not limited by the choice of simply not being able to go out and, for example, speak to people or have other forms of engagement. Yes, then we will find those ways of taking the best of both worlds. I very much believe in that.
The future for you, Ruth?
I think that ultimately, when we can go back to face-to-face research, I think that that there will always be some aspects of blending the two together. And I think the challenge for us technically is to be able to ensure that on the back end, where the researchers gather and analyse their data, we're able to bring both real world responses and online responses together, so that eases that pathway for researchers. But I think in terms of accessibility and access, there will always be a combination of different methods to use.
So, Lisa, are we going to go back, or do you think this is something that is set in stone permanently now? And what's the right balance?
Balance is, I think, absolutely what we need to think about going forward. When I'm sure we're not going to go back to where we were at the beginning of 2020. We have seen through necessity the many advantages to doing research remotely. But I would like to see us going forward with a much more blended approach, where we think really carefully about what the research project needs and think about the appropriate ways of gathering the data for each of those projects. So a kind of mixed, blended future is what I foresee. And I'm very excited about it.
Sanhita, what about you? Where's the future?
So I think I agree with the other panelists that the mixed blended approach would be the way forward, particularly sort of getting the voice of some of our colleagues who are much more digitally more savvy, and there's so much we can reach out through the social media and other platforms that we can actually synthesize quite quickly. However, I always see the place for a face-to-face for those vulnerable patients, for clients, where, if you're doing research around perinatal mental health, children's mental health, there needs to be an approach where we need to be able to do those face-to-face. So very exciting that we've shifted our thinking so rapidly in the last couple of months, but I see, as Alicia says, the blended way forward, but assessing and learning all the way through.
Sandra, I want to leave the last word with you on this very much, because I suspect that for a lot of people who are involved in this kind of research, particularly younger people, they can't imagine that it was ever done in any other way. And this seems to be the kind of the way that it should be done. But is that the case? And do you think that more people now, I mean, you suggested it, I think, but a bit before, that more people would be willing to be involved in research?
110%. I think, though, however, our mothers, they miss the face-to-face interaction. They miss the, engagement and bringing their kids out and speaking and communicating physically. That's the element of our, group, why it has been so positive and so impactful in the last couple of years, is because of the face-to-face events and workshops. However, when engaging with researchers and projects, I think, using online platforms is an excellent way to engage with the motherhood and the BAME community, because otherwise travel, childcare, all of these other factors might put them off from taking part in research. So as our amazing panel have said today, I think a blended approach will be the best way forward.
Fantastic. That's why I wanted to leave the last word with you, because I think that, you speak for so many people who are involved in research. They're happy to do it, but actually this remote makes it possible and easier for them to do it. So thank you all very much indeed. Terrific discussion. We had lots of questions. I hope that those questions and the discussion will continue on the forum. And I'm going to say goodbye to you and welcome our next panel. Thank you.